Welcome to the Tic-Tective Podcast, a program of the Bay Area Lyme Foundation, where our mission is to make Lyme disease easy to diagnose and simple to cure. I'm your host, Dana Parrish, and I'm the co-author of the book Chronic, and I sit on the advisory board of Bay Area Lyme Foundation. This program offers insightful interviews with scientists, clinicians, patients, and other interesting people. We're a nonprofit based in Silicon Valley, and thanks to a generous grant that covers 100% of our overhead, all of your donations go directly to our research and prevention programs. For more information about Lyme disease, please visit us at bayarealyme.org. Thank you for joining us for another episode of Tic-Tective. I'm thrilled to bring you this interview today with Dr. Kelley. She's the founder of Case Integrative Health in Chicago. She's board certified in integrative medicine. I absolutely loved all the tips she shared about Lyme, tick-borne diseases, mold illness, long COVID, POTS, dysautonomia, all the things that we struggle with as patients with complex chronic illness, for which general medicine sometimes fails to have great answers. Please subscribe to our YouTube and Spotify channels and support this podcast. We really appreciate your help and engagement in sharing the truth about Lyme. Everybody needs to know. It is so important. So many people are still struggling, and we want to help. So I heard that you had your own health story. And I always think if a doctor gets into this field, it's because they have a personal connection to it, either through them or a loved one or child. Would you mind sharing a little bit about your health journey?
Yeah, absolutely. I agree with you. I think a lot of docs, they kind of find their way to this because of their own personal struggles or their family struggles with it, because it still is controversial. In a lot of ways, it's much better than it was 10, 15, 20 years ago.
Yeah.
But it's still, it's a little scary to kind of jump into that. And so when you're forced to do that with your own struggles, and then once you're in it and you realize how prevalent it is. But yeah, mine started actually in college. I started dealing with severe fatigue that I hadn't had before. I was pretty active in high school, track, show choir, all that stuff. And then in college, I had a hard time walking up the hill to my dorm, and I felt short of breath and really tired all the time. I was napping more than ever, and I didn't get it and what was going on. And I went to the doctor, and I was actually diagnosed with asthma.
And where did you grow up, by the way?
I am from Ohio originally.
Okay.
Yeah,
And did you go to school in that area too?
I went to school in Ohio as well.
Okay.
Yeah. I went to Dayton for undergrad and Ohio State for med school. So it's all central area, Ohio. And I grew up, just running around barefoot in my neighborhood all the time. I went to summer camp in the woods, in tents. And I don't remember ever having a tick bite.
Isn't that the norm, is that most people never see a tick bite. They don't see a rash. And they tell you, I have all these symptoms, but it can't be Lyme because I never got a tick bite.
Exactly. My mom also suffered from chronic fatigue. So who knows, where if we just picked it up together or what, it's all speculative at that point. Yep. But so I was misdiagnosed with asthma, and albuterol just made my heart race and didn't really help. And then I went right into med school, and I was still dealing with all of these symptoms. And I started to develop postural orthostatic tachycardia symptoms. And as a med student, you tend to, sometimes you kind of think you have everything you're studying and everything you're learning about.
Yes, I have heard about that affliction. Every time I interview another doctor or scientist too, I'm pretty sure I'm dying. I'm pretty sure they said the one thing, I'm like, oh, I hadn't considered that. And that's what I'm dying from right at this moment. Yeah. I totally get it.
It's very common. But I looked at, and POTS is not a, highly studied thing, at least not necessarily when I was in med school, but I linked onto it. I said, I think that's what's happening to me. So I kind of forced the issue. I went to my doctors, you're going to test me for this. I got to know what's going on. So I did. I went to the tilt table study, which is an awful test where you get strapped to a board and then flung upright, and they monitor your symptoms and see how you're doing. And it's absolutely miserable. If you don't pass out, you feel like you're going to pass out. So I was diagnosed with it, and then I tried several different medications, and nothing really was helping. And I tried several different kinds of medications. As med school went on, and the more work you do and the more hours you work, I just felt worse and worse and worse. over the years. And I did eventually find some medicines that kind of helped to balance it, but nothing fixed it. And I felt very medicated, and I had compression stockings that I would wear every day, and I had to carry salt water bottles around and just kind of suffer my way through.
Yeah. So for people who are new to hearing about POTS, and you talked about compression stockings and drinking electrolytes, can you just explain the rationale for doing that?
Absolutely. So POTS, or postural orthostatic tachycardia syndrome, is a problem with your autonomic nervous system. So it's called dysautonomia. And the autonomic nervous system is what helps control things we don't have to think about: our breathing, our digestion, our heart rate, things like that. And with the postural orthostatic tachycardia, the system doesn't regulate the way it's supposed to. Your body is supposed to regulate when you stand up to account for gravity in a way that you don't notice. And your body makes these subtle changes, and life goes on. But with POTS, it doesn't. So when you stand up, your heart rate can go up and goes through the roof. And you can also get blood pressure drops and get really dizzy and pass out. And along with that, you also can get fatigue, brain fog, aches and pains. A lot of it sounds like Lyme, right?
Yeah.
In there. GI dysfunction, it can kind of manifest in many different ways. For me, it felt like I was just running a marathon all day, every day, because my heart rate, even at rest, would be 120, 140 beats per minute. And
That's scary.
it's exhausting.
Yeah.
And, as a med student and a resident, and you're on rounds, you're on your feet all the day, all day, running around the hospital, people are asking you really important questions, and you're just trying not to pass out. Like,
Totally.
how do I grip onto things? So salt helps a lot. That helps keep the fluid in the blood vessels a little bit better, so you can push the fluid up to your brain. And then compression stockings do the same. So that helps to prevent some of the pooling that can happen of our blood in our legs. And if our blood can't get all the way up to our brain, that affects and it makes the symptoms worse. So things like salt and compression stockings are things that can help. There are medications. Like I said, I took several, and there's different forms and various different families and kinds of medication that help different people. But a lot of times they're just Band-Aids. They're not actually fixing the underlying cause.
So did you find out that was Lyme, or
what
did you uncover, I guess, was really the question.
Because POTS is related to, they're not really sure exactly what causes it. There's a lot of different things. And for some people, it's chronic viral issues, but the tick-borne infections are linked to it as well. Lyme and BART being kind of the two biggest drivers, but there are other vector-borne diseases that will cause it. And I didn't really figure any of that out until after I was done with residency, actually. And I was into my integrative medicine practice, and I was out and about, and I actually kept going to conferences, and I heard Dr. Horowitz speak a couple of times, and he talked about Bartonella and POTS, and I ignored it for a year or two. And then
were you better at that point, or were you just managing your symptoms? Yeah.
I was better. In part because I wasn't on call every third day anymore. And so my adrenals had a chance to recover and repair. And I had spent a lot of time working on that. And I still had the POTS symptoms, but I could manage it much better, but it was still there at that point. Yeah. Yeah.
It's really scary to have that symptom. I actually didn't have that. It's like one of the only things I didn't have when I was really sick with Lyme and Bartonella, but I know a lot of people who have it. And now long COVID seems to be the great exploder of that symptom.
Absolutely.
It's really, it feels so much, it feels so much to me like Lyme. Do you share my sentiments about
like long hauler and COVID?
Yeah.
Absolutely. I think at the end of the day, all of them, really, these chronic complex vector-borne illnesses and COVID, they change your immune system. They're really, to me, more immunological versus infectious. So it's the immune system ramifications and the changes in that. And they're very similar, if not very exactly the same, probably too, as we kind of dive into it.
So inflammatory.
Exactly.
Yeah. Totally agree. Do you think that COVID or long COVID or both are activating latent Lyme and vector-borne stuff?
100%. Yeah. 100%. Yeah. I think I have one long hauler patient that doesn't have a tick-borne infection or vector-borne infection. Yeah.
That's interesting. So, day one, a long COVID patient comes to see you. Are you working them up for tick-borne diseases?
Absolutely. Yep. Absolutely.
That's really great. What do you think about toxic mold in that picture and that complex stew.
Yeah, it's one of those, what's the chicken and what's the egg? But it is very common, just like with COVID or even the COVID vaccine, if you have an underlying vector-borne infection, whether you know it or not, and then you get exposed to a really big toxic mold hit, that is enough to kind of wake up everything. And so where things were kind of okay or stable or just mild and you didn't know, and now all of a sudden, the floodgates are open. Mold is a huge immune inflammatory problem. And so it can absolutely wake up the infections, just like a chronic stress of, maybe a divorce or, a loss or COVID, these big reactions, big life events can 100% wake up these kind of static infections. Yeah.
Do you think that your long COVID patients or your COVID patients, I assume people call you maybe when they have acute infections, your current patients, are your Lyme patients more susceptible to long-term stuff from COVID or a bigger immune hit than the average person?
Depends on where they are really in treatment. I think, if you are in the middle of treatment for Lyme or you've had Lyme and you're kind of working through it and you're in a remission stage, and can address these issues differently, right? So these patients tend to set themselves up for success better vitamin D, better immune support, et cetera. So they may be less likely to get the long-term ramifications. Yeah. And I have patients who are on full Lyme treatment who get COVID and they seem to be okay. It doesn't seem to necessarily knock them all the way back to the beginning. Yeah. As I think the bigger problem I see is the ones who didn't know they had Lyme or other vector-borne infections. They don't know how to, address cytokine storms and help manage that. They're the ones who are really getting hit.
Yeah. I am seeing a lot of overlap in the discovery of certain treatments in the COVID world, like LDN, HBOT. People are talking about nattokinase and all kinds of stuff that would be very familiar in the Lyme world that seems to be helping, at least to varying degrees. So what's cool about you, among other things, is that you treat kids and you treat adults, which is kind of rare in the Lyme world, as you probably know. I'm curious about what you are seeing with kids versus adults and where you begin the workup individually.
Yeah. Yeah. And we address each patient individually as much as possible because it is such, a different beast in different bodies. Yeah. So we really do have to approach it one by one. But yeah, I'm dual certified. So I'm board certified in family medicine and integrative medicine. So I can kind of treat the whole fam. Kids are cool because they are pretty resilient. So oftentimes we can get them back to better shape faster because they don't have 40 years of life behind them that we also have to clean up and deal with. So there is a fair amount of that. But, and I try, if possible, often to go more herbal route with kids just to try to protect their gut. But I'm not afraid to use meds if we need to. We have to do whatever we need to do. I just put a kiddo today on 3 months of medicine at least because their symptoms are back and they need to, I'm like, let's deal with this today. And so that we don't have to deal with this when you're 20 and 24.
And you're talking about antibiotics when you're saying you're talking about like more allopathic stuff.
That one was allopathic. Yeah. That particular case, but it's varied. So we use herbs, we use prescriptions that are all weight-based, kid-based, kid-friendly stuff. And and the little bitties, I maybe try not to do as much blood as I would do on an adult. And an adult, I'm going to do 20 to 30 vials of blood to get as much information as possible. I'm not going to do that much on a kid. I'm going to be much more succinct in a kid. Kids are tricky though, because they don't always have the words to explain what's happening. Yeah. So sometimes I have to use more out-of-pocket testing to try to find different things in a different way that I can monitor more on a blood lab level versus symptom level. You have to use both because our labs kind of stink still.
So for parents who may be sort of new to this topic, but have worries about their kids or behaviors or certain symptoms, what are the predominant symptoms that you see in kids?
Fatigue and pain will still happen. And it's going to be hard to differentiate sometimes because the pain can get chalked up as growing pains.
Yes.
And that, and that's easier to kind of brush off as that at times. But kids will often have behavior changes. So, once, the kid was once vibrant, very happy, easygoing kid, all of a sudden can't go to school because of
Yeah.
severe anxiety, all of a sudden is, banging their head against the wall. So there's a lot of those behavioral flips, and they can
Yeah.
be very dramatic, a la, Pan's Pandas kids. It can
Yeah.
be like that this change can happen. And it can vary from, kids no longer talking. They were talking before, now they're not talking.
Mm.
To tics, TICS. So,
Hmm.
movement tics or vocal tics. It ranges for sure, but that is often a clue that there's something
Yeah.
happening. That kiddo was okay one
Yeah.
week and now they're not. Yeah.
Do you often, it sounds like you do a great workup. I mean, are you usually finding tick-borne stuff in them? Are you finding toxic mold or some
All
of
of the
these?
above,
Yeah.
right? Yeah,
Yeah.
it's different. So, I mean, we always look for strep too, because I mentioned
Sure.
Pants Pandas. These are, neurological, almost autoimmune issues of the brain from that started from an infection. And pandas is strep specific, and pans is other infection.
Hmm.
So, I'm always looking for that. And then, yeah, I do start kind of trying to dig into, for sure, be a history, but also some lab work. Mold toxicity, is it different at school versus home? Because those environmental shifts can change things and play a role as well. I also do ask about vaccines, like when was their last vaccine? What did they get? How did they react?
Yeah.
Because it can just kind of waken and that fire as well.
Do you see kids reacting, having bad reactions to COVID or the COVID vaccine?
I don't see too many kids getting the vaccine these days, which I
Mhm.
think is probably good. But
Yeah.
generally speaking, a lot of these kiddos are pretty mild with COVID, if
Mm.
anything. I'm not seeing too much in the way of that. Again, unless there may be something else underlying it that we have to kind of dig into and see if it woke up. But compared to adults, kids seem to be a lot more resilient and able to fight off COVID, which is great. Doesn't
And
mean we don't have to go back and clean up and make sure everything's okay after that, but
yeah. So do the herbs work pretty well in and of themselves for kids?
I think so. Yeah, we get a lot of success from herbs. And I put people on herbs and we'll stay on them for as long as we need, and it often longer than we need
Hmm.
to do. Is I just try to really make sure, to the best of our ability, that we're clearing stuff up before we stop anything. But kids tend to respond really well to herbs, and they're easier on the gut, and they're in drop by drop, so it's a little different and easier to give to the kids
Yeah.
than some of the medications that are out there with all the yummy flavors that are in those
Yeah, right.
things.
Exactly.
But I do have kids that respond really well to meds too. So we do use meds,
Yeah.
but especially like in acute cases. So if we know they had a tick bite, a bullseye rash, that kind of stuff, I'm going to use the
Oh,
medications
yeah. Yeah.
first and
Good.
foremost. But the longer kids, the kids who've had it for longer, we will more often than not try herbs first. Because just the antibiotics are kind of like cannonballs. They do their job and they can cause a lot of destruction in their wake. And if we can help manage these symptoms and these infections without all of that destruction, we're going to try to do that if possible. So we
Yeah.
try, but
That's great. Do you have certain herbal protocols that you use? Or again, I know you seem to really individualize each person to a different treatment, but do you use like Buhner or the Zhang protocol or any of those?
yeah, we actually tend to use a lot of Beyond Balance herbs.
Hmm.
We use Nutrimetics in kids a lot too. That tends to do well. And then the Buhner style herbs in different forms. So there's lots of different companies out there that sell those herbs. Also very, very helpful. I tend to use those more for adults than
Uh-huh.
kids. And it's just a clinical preference. It's not a right or wrong at that point. But I really like the Beyond Balance herbs and the Nutrimetics for kids.
What are the actual herbs that you're seeing success with?
So Nutrimetics kind of breaks them down usually in one by one. So you give one herb at a time. Cemento and Banderol are kind of their two big
Mhm.
ones for Lyme, and stevia is their big biofilm buster, which also helps. So those are kind of two. They have others too, Commanda, Enola, Hutainia. They have other ones you can kind of layer on depending on what's going on. Cemento is cat's claw. It's a very particular kind of cat's claw, which is a Buhner herb as well. It's a very common herbal antibiotic. Beyond Balance uses combinations. They were created by a naturopath, so they use pretty symphonic, like glorious, like really pretty kind of combinations of different herbs. And they have Lyme herbs, they have Bart herbs, they have Babesia herbs, they have Ehrlichia herbs, and mold herbs, etc. So you can kind of layer them and you can dose them according to how big the kiddo or the adult is. Just we tend to get good success with that. I know there are other companies and other herbs out there, and these are not necessarily better. It's just what we've had success with at my clinic.
And people always want to know the specifics, because somebody's going to play this for their pediatrician and they'll know the companies that you feel you can trust. And so that's really, really helpful actually to hear. I'm wondering too, what other elements do you think are most prevalent in causing complex chronic illness? I've heard you talk about the nervous system before, and it seems like you really do address that and have a lot of cool strategies for the nervous system stuff. What do you think about it?
To focus on the nervous system, I think the nervous system is utterly important to healing. So we talked about the autonomic nervous system, and that's also can be broken down into sympathetic and parasympathetic, which is also our fight or flight or rest or digest system. And that entire system gets really thrown off with chronic infections, exactly the same way that trauma with a capital T will cause dysfunction in the system. And what happens is we end up living in this chronic fight or flight state. And that is not how our bodies are designed. Our bodies are designed to flare up when the lion is chasing us and then calm down when it's gone. But we just don't live in a culture, society, or world where we are able to ever really relax. A lot of people think they don't have a lot of stress, but when you talk about the background stress, that's just kind of always there that we get used to.
Yeah.
That just kind of leaves us in this perpetual state. So when we have infections in there, spurring that on as well, and we're never ever giving our system a chance to relax and recover, our brain starts to think that it's doing good by sending out all of this inflammation. Aren't you happy? I am sending out inflammation to fight this infection, or fight this pollen, or, whatever the case may be. And God love the brain. I mean, it's trying to help us, right? But it just becomes overzealous and it becomes too much. And we never retrain it to calm down and stop. So we get these very, very real perpetual, inflammation driven by our nervous system. And so while we're working on fighting the infections and trying to help the immune system and calm all that down, the patients that I can convince to do vagus nerve and limbic system repair work to help reset this system, get better faster, stay better longer. Full stop. Wow. It's hard to really convince people to do that work sometimes because it is work. And
they want to know it's going to work. I mean, whenever I've talked to people about that, how do you know it's going to work? Well, you got to try it. It does work for a lot of people, right? I mean, it's really, really good.
Really. And there's a lot of different ways to go about it too. So it's not like there's a right or wrong. I was actually talking to a patient this morning, she's a working mom, and just the thought of like one more thing for her to have to add to her plate was just too much, so we brainstormed some ways that we don't have to add any extra time. It can all be very passive, like wearable devices or other things to help reset our system, or some earplugs and headphones that you listen to while you're sleeping. What can we be doing that doesn't add extra stress or time? Because the last thing I need to do is say, hey, working mom of 3 with Lyme, I need you to stop and take an hour every single day and think of nothing, because that's not going to happen. Let's be realistic, right? It'd be glorious, but it's just not going to happen. So how do we start this now? So we have some built-in time during the day where we can just go and break and pause. And even just those little pauses can help a lot. And if we get that started, that helps to retrain the system, and it can kind of build from there.
Are there certain programs that you particularly like?
Yeah, there are several programs out there designed really to dive into this. One of my favorites is Primal Trust. I think she does a really good job of bringing in multiple different aspects of limbic system repair and vagus repair. I know a lot of patients have success with Vital Side. There are some others out there too, and even newer ones. I just heard of a new one, Reorigin or something. There's always kind of these new products out there or new programs, but just like everything else, I offer these options, here's my favorite, but it may not sing to you. So you may like one of these other ones. So here are some things, look at them. What makes sense to you? What are you going to resonate with? What's going to work for you?
So you mentioned something about wearing headphones when you go to sleep and falling asleep. What are we referring to exactly for something like that?
Yeah. So binaural beats. Have you ever heard of this?
Peripherally, but I
Yeah.
don't know anything about them.
So it's really cool. So binaural beats, the reason you have to wear headphones to listen to this is they will play a different hertz in each ear. And the difference in each ear correlates with different brain waves. So I'll just make it up. It's 210 hertz in this ear, 215 in this ear. So the difference is 5 hertz, which relates to a different brain wave.
Okay.
And some of these are more related to delta brain waves, which are calmer, or more focused brain waves. We've got alpha, beta, delta, gamma. We've got all these brain waves. And when our brain's not working properly and it's just like running around like this, these binaural beats can just help smooth it out. And so you can listen to it for sleep. You can listen to it for stress. You can listen to it while you're studying, actually, and it might help you remember things a little bit better.
Wow.
And it's very passive. You just listen. You don't have to do anything. It does it for you. But it does need to be headphones because the difference in ears matters. But it's just a very passive way to help retrain that brain and start to kind of ease into that. And there are free apps out there that have loads of these. Insight Timer is one. There are others that are paid where you can pay for them too and get different options out there. And it's tricky because I don't love Bluetooth wired
I wear
headphones.
my wired headphones like an old lady because of the radiation.
No, you should. But they make flat headphones with a cord. It's hard to find these days, but they make them with a cord.
Cool. So you can actually lay down and not be like, ah.
Exactly. Yeah, they're like a headband. They're flat on your ears, and then they do have like an actual headphone jack. So you don't have to have the Bluetooth on your head at night, because I don't love that.
I would definitely highly recommend doing that. Getting those. Definitely wired headsets are better. I think it sounds like anybody could benefit from it. You don't have to have Lyme or complex chronic illness or feel bad. You probably can just benefit from taking control of that stress response, no matter who you are. When you were saying that, I was thinking about EMDR when you were talking about falling asleep like that, right? With back and forth. Is there anything similar? And do you feel like trauma is playing a role in chronic illness?
Yeah, it is for sure. And, not for everybody necessarily. And sometimes traumas can be things that don't necessarily feel like it should be traumatic. If you think we can kind of judge ourselves and say like, that shouldn't have been traumatizing for me. Even just like getting made fun of as a kid by another kid, can kind of stick with us for a long time. So it has a big impact on our overall health and our ability to heal and overcome and work through things. So I think that it's important. And EMDR is a great way to really kind of work through trauma. It's an eye movement desensitization process to get your logical brain and your feeling brain to connect a little bit better and faster. I think these days they use more like little vibrating things in each of your hands instead of the eye movements. But I think this is great. I have a lot of patients with a lot of success with EMDR. My like caveat to that is make sure you work with somebody who can help when you're done with the process, when you're done with the session, to bring you back and calm you down, to help smooth the edges so you can enter back into world and life. I've had a couple people kind of left raw after EMDR. I don't think their therapist was fully closing the loop for them. And it took a lot longer for them to work through that. So just make sure you find a provider that you like, that you feel like you trust, and who is going to help you work through that whole process each session so that you're ready to go back into real life after that.
I know that you're integrative, and one of the things you must be always thinking about is Herxheimer's, calming things down, detoxing. And I'm curious to know, what are your tips and strategies for that?
Yeah, herxing is a big part of everything. It's a big conversation we always have to warn people about, because if it's where you can get worse before you get better. And at the end of the day, it's an immune reaction. It's our cytokines and our inflammatory markers getting spurred up when we start to kill off these infections, and your immune system reacting to all of that, which it's supposed to do. It's a good thing, but there's a balance between, okay, this is manageable and I can get through this, and I can't function. I tell patients, if it's a no, you'll know.
Yeah,
we need to stop and kind of work through that.
Absolutely.
The two big kind of areas that I focus on for managing these die-off reactions, these Herxheimer-like reactions, is detox and making sure you're managing your toxin burden and lowering inflammation. So those are two big ones. And I have sheets of information that I give to patients, everyone's going to react to different things. So you have to try a couple things sometimes and see what's going to help you particularly. But for kids, for example, an Epsom salt bath can go a long way to really just help them soothe and calm and feel whole. They can be a different person when they get out of that bath. Glutathione is also pretty helpful, especially with a lot of neurological issues, whether it's pills or sprays or liposomal. It can kind of calm things down, take the edge off. Binders are another one. Charcoal, clay, zeolite, pectin. There's a lot of different ones out there, but just mops, if you will, to help kind of mop up the toxins that are getting flushed around from all of this. I have a little detox lemonade that I've kind of created. Alka-Seltzer Gold is a product that is really no longer available from what I can tell from a lot of patients.
Yeah, what is that about? It's so weird.
Don't know what happened to it, but you can kind of make your own. So if you do some baking soda, whether it's a teaspoon or a tablespoon, juice of half of a lemon, put a couple drops of stevia in there if you want. It's my little detox lemonade.
Oh.
It's very alkalizing. We get very acidic when this is going on. So that can also help a lot. You might want to use a straw because it can affect your enamel with the lemon juice.
Oh, good point.
But those are a couple of things that just will help really take the edge off. And I tell people if you do these things and it takes the edge off and it takes it from an 8 to a 6 or an 8 to a 5, this is a Herx. I was warned about this. I can manage this. I can get through this.
Yeah.
If if you're up at an 8, you try several things and nothing is changing, it might be a side effect or something else. So then you got to reach back out to your provider to try to adjust. Do we stop that medicine? Do we switch to different herbs? Like, where are we on that or what? Because I don't want I personally don't want people to be so miserable with the Herxheimer that they cannot function, because that creates more of a mess for me to help clean up when we're done. So for me, it's more of yeah, you might be uncomfortable. You might not feel great. Let's see if we can manage that, because then it will get better. And it's a sign that things are working. It's a sign that we're on the right track, that we are upsetting something and it's upsetting your system and you're reacting, and that's a good thing.
Yeah, I know.
Level,
I know.
right?
I know. It is a hard thing when you're new to this and you're just going through it. I know from my own experience. It's like, what are you talking about? I'm going to get worse before I get better. Why is this happening? I must be allergic to all these things. You have all these ideas and they're totally logical. And yet the whole thing, it really is hard to make sense of, but it is true. You do experience these Herxheimers, and it is a scientific fact, actually. We talked a little bit about kids and psych symptoms and PANS and PANDAS, but I think what's lost on a lot of people is how often these infections in adults cause anxiety, depression, OCD, memory stuff. Are you seeing that in your practice? And what does that look like? And does it get better when you treat?
It does get better. Yes. And I do see it. Absolutely. We call these PANDAS because the P is for pediatric, but I see it in adults as well. And I do have some patients that is really the only new symptom they have, is this new onset anxiety they've never had before in their life.
Yeah.
Bartonella also causes these anger outbursts.
Yeah.
I call it hulking out, because you can't control it. And you almost are watching yourself do this. Like, why am I so angry? It doesn't make sense.
I literally talked to somebody about this morning who recovered from Bartonella, but she was saying, like, I can't believe how I was. I was like insane. And now I can't even imagine behaving that way. Yeah.
It absolutely. And it goes to show that a lot of these, mental health disorders are not a serotonin deficiency. It's a symptom of brain inflammation.
Absolutely.
So what's causing that brain inflammation? These infections will get into the brain. They cross the blood-brain barrier. They can affect, irritate, annoy the brain. And the brain doesn't know what to do other than be anxious, be depressed. Yeah. So it is unfortunately more common than you want to see. The flip side of it too is when the patients come in and they've been sick for 5, 10, 15 years, no one can figure out why. That's also just in and of itself depressing. It's awful. And so they're so sick of being sick that, that also plays a role in the mood changes that happen from this.
When do people get to you? How many doctors have they seen? How many months or years has it been where they've been sick with nothing, no answer?
Yeah. It's, it's very common for people to be sick for a while. I mean,
Mm,
anywhere from 5 to 10. I think 20 years, 30 years, every once in a while, we'll get some of those. We get acute tick bites as well. So we do have people that come in kind of early enough that are savvy enough to really get in and get it treated properly. But a lot of these people are sick. I would say the average is probably 2 to 5 would
to
be
the,
how long they're sick before they find some, like, are just fed
wow.
up with the rigmarole to go look deeper.
What do you do for acute tick bites? What is your treatment for kids and adults?
Usually antibiotics, and we'll do at least 30 days of
Yeah.
antibiotics. Doxycycline is kind of one of the biggest ones that
Yeah.
we'll use even in kids.
Hmm.
There's some talk about teeth issues in kids. It can hurt or can stain their teeth, but it stains baby teeth. It's not a permanent adult tooth issue. But you can always stop that medicine, switch to another one if they get that. But even the CDC says now it's okay to give them
Yeah.
doxycycline. Um, so that's kind of the mainstay. If someone's had Lyme before, I will
Hmm.
often add tinidazole to that as well. We don't typically do any testing until it's about 6 weeks or so past the tick bite because we're typically testing antibodies, and that takes a little while for those to form and develop. So we just treat based on symptoms. It's very clinical diagnosis
Sure.
for acute bites. And, we err on the side of caution is kind of, well, you just bought yourself 30 days of doxycycline. I can't
Yeah.
prove it for another couple weeks after that, but
Yeah.
here's the trade-offs. So, and we're always giving probiotics along with it and detox support along with it. Usually the acute cases don't have a whole lot of herxing. Usually,
That
if
makes
they've got
sense.
joint pain, swelling, fever, etc., the doxy will just, like, within a day or two, symptoms are gone, and they don't have the herxing reactions that long chronic Lyme has.
So will you treat a bite before any symptoms? So if your patient calls, says, oh my God, I just pulled a tick off my arm or off my kid's leg or whatever, will you treat the bite?
So ideally, what happens if you find a tick is you send the tick in. So
Hmm.
if I had a couple this summer where parents found the tick bite, knew to send the tick in. There was no bullseye rash, there was no fever, no joint pain, no diarrhea. Like, kid was normal.
Okay.
But we had the tick, so we could send the tick in. So, and the tick reports that where you send these to, and there's a couple websites where you can send ticks into tickreport.com, Ticknology. I think there's a couple others.
Mhm.
Those results come back quickly. So they come back within a couple days. So we're usually still within our window so that if they're not having any symptoms whatsoever and we have a tick, I would rather not give you 30 days of doxycycline if I don't have to.
Mm,
So we can wait in that sense, or we can give some herbs.
mm.
Astragalus is a really good herb immediately when you get a tick bite. In an adult, I would do about 3,000 milligrams twice a day of
Oh,
astragalus
that's
with a tick
great.
bite. So there are, and I have a blog on my website actually about acute tick bites and where to send the ticks and what herbs you can take, and to
Awesome.
monitor. So some of these people we closely monitor to see if anything develops. If we don't save the tick, we know we're in an endemic area. Brother or sister has had Lyme, all of the things, then we might opt to do medications. It's a conversation, with the
Yeah.
patient and the family. What do we want to do here? What's the risks? What's the benefits? Where are we? Do we do herbs? Do we do meds? Where is that spot? If they have any kind of symptoms develop within that first month, they're meds. They get meds.
Yeah.
Yeah, absolutely. Yeah.
It's so wily. I was treated within 5 days of my bite with 21 days of doxy, and I still had heart failure 5 months later and everything in between.
Yeah.
So I'm a pretty strong advocate for treating. Like,
Yeah.
just like benefit to me
Just
far
treat it.
outweighs. Yeah,
Yeah.
it's
I heard an ER doc recently say that there in this way, I think this doc works in Nashville. And so they
Mhm,
said there's all these kids come in with ADD and it's
mhm.
acute doxycycline deficiency, and the kind of the it's just really funny, right? And
Wow. Actually,
yeah,
I'm sort of impressed.
I am too. I know I was great. And I've heard some docs say too, it's like doxycycline saves lives. It's 100%. Yeah. And so,
Absolutely.
if we have the right tools and we can wait, great. If not, why wait? The biggest problem, like, It's antibiotics, right? We have to be mindful about that and we need to be cautious and we have to be good stewards of antibiotic use in
Sure.
our world. But within reason. But if there is a high suspicion, if there are any clinical symptoms of it, do not wait, do not hesitate, just do it. And I will do at least 30 days of
Yeah.
treatment.
Yeah.
It's often more like 2 months because I got to wait for the labs to be able to get drawn and stuff. So I don't want to stop anybody early, but at least 30 days to get to a full life cycle of the bacterium.
Yeah. Okay. That is really helpful to know. And before we go, just your favorite lab, your favorite tick-borne disease labs, your favorite mycotoxin labs.
There has been a kind of an increase in research recently where people are looking at different ways to test for these so that we can try to get an insight into acute, chronic, cured, or remission, whatever word you want to use there.
Yeah.
That is going to help patients and doctors. Like we're going to move eons ahead in the treatment of these things once we have that information readily, easily at our fingertips.
Totally.
So I use a lot of IGeneX labs testing, and I will use Vibrant Labs as well. I use MDL, which is Medical Diagnostic Laboratory, which you can bill through insurance. I will also use T Labs. That's a newer lab. It's an RNA probe to look for the active infections. Sometimes we use Infecto or Galaxy. It really, we use the tools that we can when we need them.
Yeah.
I do try to be mindful because these things add up and they are expensive, and I don't want to just do the test for academic purposes. If I'm recommending a test for you, it's because this is going to affect your treatment. This is going to matter. This is going to tell us where we are, and I need that information. So that's why I'm asking to do this test. But there are tests out there. There are things that are getting better too. But I would never, ever, ever, ever just rely solely on Quest or LabCorp, especially if they're negative.
Never. Right.
Never.
What about for mold mycotoxin testing?
Mold, yeah. So I tend to do a lot of blood work to look for patterns that we would see in mold, maybe versus Lyme. Some of these different blood markers, C4A, MMP9, VEGF, TGF beta, are kind of looking for different patterns in the blood work.
Interesting.
The mold testing, there is a blood test nowadays. It's still pretty new. It's an antibody test. But it's an antibody test, just like the Lyme. It could be an old exposure that's really hard for me to kind of pinpoint, is this there or not?
Absolutely.
And the urine testing for mold, it's really only showing what you're peeing out. So it's not showing what's in your tissues. So as long as you know that that's what you're looking at when you look at that test, and depending on the test, you may do some glutathione ahead of time or a sauna or sweating before you collect that to try to get a better outflow of it. I do think it shows your body burden of the different kinds of mold.
That's what I was going to ask.
Reacting to.
So do you take it seriously if those tests are higher? Do you say that is probably what's going on with, some of these symptoms?
Yeah. And I do so much just detox in general, and I'm kind of usually doing broad sweeps there to help detox. And so I'm usually covering mold too. So, I may not always ask the patients to pay the money for the mycotoxin test, at least at the beginning, unless like red flags are going off and I feel like I need to. So it's not always one I jump for right away because it is an out-of-pocket test. But we'll use it if we need to. And there are different binders for different mycotoxins. So it can be useful to help really differentiate and kind of zone in on what that patient needs.
Yeah.
So, yeah.
I just learned something really cool the other day, which you probably know from Neil Nathan, that Medicare covers real-time labs, which I didn't know because it's expensive if you pay out of pocket. But I made my parents get real-time because they lived in a moldy house and my mom's levels were off the charts, like completely nuts. Yeah. But it was great that they covered that test. It's really cool.
Yeah. I think IGeneX takes Medicare too.
Oh, really? Okay. Well, they're next on the list.
Sorry, parents.
Sorry, mom and dad. But Dr. Kelley says, where can people find you? First of all, also, are you guys taking new patients? And can people come and see you? Best website to go to, everything?
Absolutely. Yeah, we are at caseintegrativehealth.com. We're in Chicago. We are still seeing patients. So we do have a little bit of a wait list, but I have a
Okay.
strong team here, and it's not just me. I have a couple of physician assistants and other docs who are seeing patients too. And we have a great team of providers. We meet on rounds every morning. We all kind of know what's happening for the day and what the patients are and what's going on. We do televisits. We do ask people to come in for their first visit so they can establish care with us. And it kind of depends on where you live and how that all works. I do have some international consulting patients where I can kind of consult on that level. Happy to help in whatever way that we can.
Well, it's great to talk to you. Thank you so much for your time and for your insight. Really appreciate it.
Yeah, thank you for having me and putting this together and sharing the word and getting the word out, because it's really important information that we need more people to know about.
Thank you for joining us for this episode of Tictective, a program of the Bay Area Lyme Foundation. For more information or to get involved, please visit us at bayarealyme.org.